Good morning, everyone. I'm just so pleased to be here, and I am so proud to introduce our state's 47th governor, Sarah Huckabee Sanders. Governor Sanders is a true leader who cares deeply about our state and who is bringing positive changes to so many areas. She is a champion for all Arkansans, and I'm grateful for all she has done to bring us together, to bring this group together to focus on maternal health and women's health. Her leadership on these critical issues is inspiring. Since taking office last year, Governor Sanders has been busy. She has spearheaded a sweeping overhaul of Arkansas's education system, which promises to make children safer and smarter. She is working to grow Arkansas's outdoor economy and improve state parks and spaces where kids can truly be kids. She has led efforts to combat human trafficking, to recruit new foster parents, to cut taxes, to improve public safety, and so much more. Governor Sanders is the first woman to serve as Arkansas's governor, and she is mom to Scarlett, Huck, and George. Governor Sanders wants the best for her family and for all families. She understands the issues we are here to discuss and the problems we aim to solve. And we are so appreciative of her leadership and her support. Help me welcome to the stage Governor Sanders.
Thank you very much. Good morning. Thank you. Good morning. Thank you so much, and thank you, Dr. Chandler, for such a kind introduction. I'd like to start this morning off by offering my deepest condolences to the family and friends and to the entire state of Arkansas for David Pryor. Arkansas lost a giant this weekend, one of what we affectionately referred to as the Big Three, who defined Arkansas politics for decades. Though he and I came up in different parties, I was always moved by David's friendliness towards me and my family, and I deeply respected his stewardship of Arkansas interests. I know that he would be proud of the group that is convened here this morning. And it's an honor to come together with this group for the first strategic committee on maternal health only a little over a month after I signed an executive order establishing this group. This is a big issue in our state, and we're moving fast to find solutions. Before I begin, I'd like to also make an important announcement about one of the pro-family policies that we've had the chance to bring to Arkansas. Summer EBT, which provides low-income Arkansas families with money for food in the summer months. The applications will go live today, opening up and providing for Arkansas families across the state. It's just one of the many initiatives that we're using to support healthy moms, healthy kids, and healthy families here in Arkansas. With me this morning are the leaders who will help us solve Arkansas's maternal health crisis. They come from across state government and beyond, and they have the knowledge and influence we need to tackle this problem head on. As a mom, and as the first mom to serve as Arkansas's governor, maternal health is something that I take personally. My own kids weren't born that long ago, at least I like to think so anyway. I'm the first governor to have elementary-aged kids in the governor's mansion since Chelsea Clinton grew up there. Having given birth to 3 kids, I know what the experience is like, and no woman in our state should go without the support she needs, and yet far too many do. Of the roughly 35,000 pregnancies in Arkansas each year, 10,000 women don't see a doctor until after their first trimester. 1,100 women don't see a doctor until they are in labor. Healthy moms mean healthy babies, but it is hard to know that you're healthy and have a healthy pregnancy if you aren't seeing a doctor. The good news is that Arkansas already has resources available for expecting mothers through pregnancy and far beyond that. There are 70 health units in this state that offer maternal and prenatal care at no out-of-pocket cost. Arkansas has also recently expanded insurance eligibility for pregnant women. But when 1,100 women don't see a doctor until they're in labor, even though services are available, that's not a coverage problem, it's an education problem. And it's a problem that this strategic committee is going to be laser focused on solving. These leaders are going to craft a statewide strategic maternal health plan focused on 4 main points: education, access, coordination, and overall making significant improvements to our state's maternal health. Part of that will involve advertising and awareness. Part of that will be grants and funding. And a major initial focus of this group will be creating a pilot program in counties with low rates of prenatal care that connect women with available health care resources. Each of the leaders we've gathered is an expert in some aspect of this area, whether it's education, medicine, or Medicaid. And I know each of them is just as committed to this issue as I am. We're all here today because the truth is maternal health is a complicated problem. There isn't one single policy that will fix it, and it will take all of us in government and outside of government working together to improve outcomes. I want to thank all of our participants for being here today to kick off this strategic committee, and I'm looking forward to implementing the solutions that this group comes up with. Thank you all for being here again. Thank you for your commitment to this issue, and I'll turn it over to our committee members to describe their roles in this group and how we plan to move forward. Thank you so much for being here today.
Good morning. Renee Mallory, Secretary of Health, and what my position on the committee, I'm representing the Department of Health. Since the executive order, we have had discussions with key leadership staff and managers to stress the importance of maternal health and ensure we have a direct focus in our applicable programs. We're looking at existing programs to evaluate our current activities and make sure they're in line with goals for better prenatal care and pregnancy outcomes. We're also making sure we're aware of and discuss any new funding opportunities that come down and partner with our leaders out there for healthier babies and healthier pregnancies. ADH is in the process of developing a new 5-year strategic plan, and maternal health will be one of our priorities. We're also actively looking at what other states are doing that we can do in Arkansas, and we've heard presentations from at least 2 companies that have set up successful platforms in other states. One of the platforms was for identifying resources and making the information easily accessible online, and the other was in transportation, which we all know is a problem. And then, of course, we have our pilot with our 5 counties across the state that Deputy Director Cochran will talk more about. Thank you.
Good morning. Thank you for joining us today. I'm Casey Cochran, Deputy Director for Public Health Programs at the Arkansas Department of Health. As Secretary Mallory mentioned, we have a pilot project that includes a county from each of our 5 public health regions that will be focusing on prenatal care and overall women's health care. Our plan will very much mirror what we're doing here today on the local level to begin with. We've identified stakeholders on the county level. We'll look for resources locally and identify those gaps that we have and then discuss how to close those gaps. So during that process, we'll talk about clinical process changes with our local health units and providers locally. Hopefully, this will help us identify those women that we have missed prenatal care with and also help to reduce the adverse events related to maternal outcomes. Also, we want to connect these women to care before conception. So it will focus on overall women's health care, preconception through maternity care. So some things that have already happened on the local level after the executive order will be discussed later in this program that surrounds the excitement in our state around the executive order and the process to work to close these gaps. Thank you.
Good morning. I'm Sam Greenfield. I am the chair of the Arkansas Maternal Mortality Review Committee. I'm also a practicing obstetrician gynecologist. My role in this activity is to be a provider of information. In Arkansas, our Maternal Mortality Review Committee reviews pregnancy-associated deaths that occur within 1 year of the end of the pregnancy. And what we're looking to do is determine the causes, contributing factors, and to help make recommendations. And we do this through a report that's produced every year. And part of my role is to make sure that everyone is aware of what the information is, how to get the information, and how to further disseminate it. We have found that about 92% of the pregnancy-related deaths are preventable, and that's the problem that we're trying to solve. Some of the activities that we have done within the committee to amplify the message, you can see on your tables. I've shared some information from a campaign that we are doing to help raise awareness. It's called Hear Her, and it's to point attention to the urgent maternal warning signs that are associated with maternal mortality. And I share this information not as a stop point for the end of the work, but for a beginning point to show what we can do and what we can do together. So this is a problem that we're all aware of. We're aware of the top causes. We're aware of some of the solutions, and this is a shared problem. So my role is to provide information, to be a content information person, to provide a clinical lens through the work that we do, and ultimately to lift the burden from the women of the state of Arkansas. So thank you for the opportunity, and I look forward to working with you.
Good morning. My name's Jacob Oliva. I'm the Secretary of Education here in the great state of Arkansas. And first, I want to just thank everybody for coming out and spending a day with us. I know anytime we ask people to disrupt their personal and professional lives, it's a big lift and it's a big ask. But I know through the hard work of the planning committees, you're going to find that today is worthwhile because we are going to create an actionable plan that's going to make a difference for Arkansans. One of the common denominators, I think, that touches not just every state agency, but every community is education. So our role at the Department of Education is to support this great work, but there's a couple different pathways that I think we're going to be able to strengthen. One of the probably most untapped resources that we often forget about in school districts is the school nurses. And how can we empower our school nurses to know about programs? They talk to families each and every single day. How do we make sure they have the information that they need to better make sure that families that are expecting children are getting access to the quality care that they deserve? We also work a lot with our early learning environments as we've been reimagining early learning and making sure that every kindergartner that comes to school in kindergarten is ready to learn. Investing in those high quality early child care programs is a constant priority of our agency, but there's also some real conversations that we're having to have in communities around access to high quality child care programs. And then education as it stands, as we look at strengthening health education, and then our roles with career and technical education and post-secondary education and everything that we're doing to support families is something that we're really excited to be a part. So thank you for joining us today. Thank you, Governor Sanders, for your leadership on taking on such an important topic.
Good morning. I'm Janet Mann. I'm the Medicaid Director and the Deputy Secretary at DHS. Thank you all for being here this morning. As Medicaid is the payer of more than half of the births in the state of Arkansas, we will play a vital role in access and services. So we'll be working with all of the partners on the committee and all of the stakeholders here today to work on better policies, better access, to increase those prenatal visits and access to care and reduce the barriers for people to get to the doctors and the hospitals. And so I look forward to working with y'all, and thank you very much.
And just very briefly, again, Christy Putnam, Secretary, Arkansas Department of Human Services, and my role in all of this is, helping convene, helping work with partner agencies, but we also have a number of other programs that partner with the Department of Health, but in our Division of Children and Family Services, prevention programs. And so our role is really to focus on prevention and making sure that we have wraparound and support services available. And we've been working very hard already to identify where can we make some earlier connections with women who maybe already have small children who are expecting and then need some additional support. So again, my role is really a convener and supporter and making sure that we're making those connections early for prevention and also for better support. And I would like to just thank everyone and ask Derek Brown to come up very briefly to give us a quick welcome as well. Thank you.
Thank you, Christy, and thank you to all of you for being here. You know, I grew up in the Mr. Rogers neighborhood era. I recently came across a quote from Fred Rogers that really stuck with me. He said, "When I was a child and I saw scary things on the television, my mom told me to always look for the helpers. She said there will always be helpers." And I'm encouraged this morning because it's not very hard to find the helpers in this room. Thank you for taking the time to be a part of this initiative. Thank you for being one of the helpers. Thank you to our government for creating this opportunity. Thank you for being the helpers, for making sure that our kids are educated and that our families are healthy and well supported. Thank you to those of you who are in the private sector for taking time from your business today to be a helper, to be a part of making sure that our families are well cared for, that our mothers are strengthened and supported and encouraged. And thank you for being a part of the future for the next generation. At Arkansas Baptist Children and Family Ministries, we are excited to be a part of this team with you. We bring our resources to the table, whether it's foster care, adoption, professional counseling, family support, whatever it may be. We're excited to bring our resources here with you. That being said, welcome to our central office here. We're excited to have you. And just a few housekeeping items. I know you want to know where the restrooms are. And so thankfully we have several options to choose from. We have a women's restroom back to my left behind these doors, men's restroom to the right. We also, through this exit, if you came in this way through our main entrance to the left and around the corner, we have restrooms over there. Also our coffee shop, if you prefer a few different options, feel free to step in there. Make yourself at home here. There are a few other restrooms just right out these doors and to the right. We're very open-handed with all of our resources, including this space, and so make yourself at home as you seek to bring resources to the table today and to be a part of the solution. Please enjoy your time here. Again, thank you so much.